Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
And welcome, everyone. Appreciate you being here. A couple of things today. We are just taking your questions, both from the restream and from, of course, our friends at Clubhouse. So we will have you raise your hand and be streaming on multiple platforms if indeed I call you up to ask your question, which hopefully we will be doing very shortly. Also, Susan Pinsky is not in the house today. Normally she is navigating, she is guiding the ship from right over there, and today she is not. However, I did see that she is in the Clubhouse chat room, so I may call her up here yet to see what's going on with her and why she's abandoned us today. Caleb is alive and well. You there in Alabama?
Oh, yes, doing great. Doing wonderful over here. Baby is growing.
Baby's
and
good.
Happy and wanting to grab all of the lights and screens and buttons in my studio here. He wants to produce.
This should be good. So if we suddenly fall off the air, you know precisely what has happened. I used to bring my kids one at a time, thankfully, or at least no more than two at a time, to the radio station when I was broadcasting in the middle of the night, and that was quite an affair when they'd crawl up on the soundboard all the time and start screwing around with the potentiometer. So the other thing, I hope, look at that. Yeah, and it was live back in those days. Now, at that point, when the kids were like 1, 2 years old, we were not yet syndicated. It was just a Los Angeles show back in those days.
Oh, yeah.
So also because Susan is not here, maybe you could put a whole screen up of this. She would want me to mention this bobblehead. She's very concerned that we get these bobbleheads a-moving. And so you get that at drdrew.com/shop. Am I getting that right? There it is.
Yeah, that's correct.
The bobbleheads get great gifts. She is, this is her with Ilana working on they are the brainchilds of this thing, and they would love you to have them. And Susan is always on me to make sure we push those out there. I've got some COVID updates to give you guys. I want to get into that in just a second. And let's see if I can coerce Susan to coming up. There you are. So did I do good with the bobblehead?
Yes, you did.
Well,
congratulations.
Thank you for joining us. Where are you?
Where do we find them again?
drdrew.com/shop.
Yes.
Well done.
That's how you find them.
So everyone.
I'm getting my hair tinted right now. It's been like, 3 months and it's time. So I'm sorry I can't be there.
And now it's time.
The blow dryers in the background.
Well, I think we got everything. Yeah, here are the blow dryers. I think we got everything done. I mean, I think we pretty much did what we need to do. And yeah, so
it looks like people are loading in on Clubhouse. If
Yes.
you're not yet on Clubhouse, and you want to join us, go to contact at drdrew.com and we'll send you an invite. You can be a Clubhouse
invitee.
Questioner.
Yeah. So Caleb has the drdrew.com/clubhouse up there on the board.
It redirects.
And if you are not what's that, Caleb?
It'll point to there. So if they go to drdrew.com/clubhouse, it'll take them straight to your profile.
Okay. And if they're not members, they need to go to Susan first, right, to get invited. Is that correct?
Yeah.
Yes, exactly.
We'll get you an invite.
So that'll be at contact@drdrew.com to get Susan Pinsky's attention. And she will, while she's getting her hair tinted, we'll send you on over to Clubhouse. All right, honey. We will talk later, okay?
Okay.
This will be
here.
fun with our friends coming over tonight. This will be good.
Okay.
It's
See ya.
okay, for me to practice my French. That's mostly what I'm looking forward to. And I like our friends too. Okay, so here we go. Let's get into some of your guys' questions and what you're all thinking about. We did a little locals meeting this morning, talked about some stuff. Andrew Ashkazvili, BA2 will be okay. I agree. So let's talk about that a little bit. So Susan sent me a headline that caught her attention and cracked me up like crazy because they are still trying to get us. Here it is. This is from is it from the Atlantic? Yeah, it's from the Atlantic. And they have now modified their language from grim landmark or grim, what would they call them? The word grim. The word grim was everywhere. Now they've switched to looming. Looming trouble. COVID is looming. So now we've gone from it's grim, gray, grim, awful. Oh, read my article, to looming. It's over us like some giant monster ready to swoop in. It's looming like an asteroid ready to hit the planet. No, it is not looming. It is not looming. And I agree with Andy Ashkazvili to his point. Here's what happened yesterday. We were watching the BBC, and we've been watching the BBC pretty carefully because they generally are sort of good. This thing is not right. They've been very I feel like they're reporting the news. One of the few places where I feel like the news I can get, which is almost impossible everywhere in the United States. But BBC is providing the news. And yesterday we saw them talk about BA2 outbreak in Hong Kong. Oh my God, they're having a huge outbreak. Oh my God, it's looming, it's grim. Here we go. They went to a physician who seemed quite knowledgeable and very professional. And he said, yeah, we've had a little outbreak here. We're down like 70% from the peak. Here's the deal. No increase in hospitalizations. Out of 3.5 million cases of BA2, there were 1,000 deaths only over the age of 80. Only over the age of 80. And I'm betting that these are pretty fragile people already who a cold could set them over the edge. You've got to understand that any significant upper respiratory process, when you're 80 and 90, becomes the old man's friend. You ever heard the term the old man's friend? That's what they're talking about. Viral pneumonias, other kinds of pneumonias, other kinds of upper respiratory processes that go bad when you're old and fragile and your immune system isn't working right. That's what happens when you age. Yes, this is a nasty one. Yes, this is a nasty upper respiratory infection for everybody over 80. 0 deaths and no increase in hospitalization out of 3.5 million cases in Hong Kong. So Andrew Ashkazvili, am I getting this right? Or is it looming here in the United States? Now, having said all that, there will be outbreaks that will be kind of nasty, I suspect, because this virus has an uncanny ability to change. And let's see. Interesting. Casey Gates went to the term old man's friend on Google and found over 400 results. So there you go. And they'll be talking about pneumonia all the way along.
On your screen, Drew,
there it is.
Literally just Googled The Atlantic and the word looming. And there were it's just pages of results. Looming bank collapse.
Looming bank collapse. When was that? What are the dates of those? What are the dates of those?
2022, there's a 2020, a 2021, another 2022.
Okay, give me the 2020. Which one was that? The looming, is that the looming economic collapse?
Yep, that's the top one.
Did that happen? Did that happen, Atlantic? Did the word looming suggest a sort of a fait accompli? It's just waiting to come in. Did it come close to happening? No. I bet. I don't know. Let's see. I'm trying to buffer my confidence and my hubris. I really want to try to always go, okay, don't be too aggressive or too confident. I don't have some magical knowledge. I have good instincts and I have a lot of experience. And so I have some confidence in my impressions. But yeah, I'm trying to, so Susan's telling me, is that you, Susan, telling me to calm down? Are you on the restream there with us? To calm down about it. So I will. And yes, it's not good to get excessively spin about this stuff. I'm looking for Andrew again on here to see if he agreed with me in my assessment, having seen the Hong Kong reports. And I've seen multiple reports about BA2 in the formal medical literature where their assessment is 30% more contagious than the original Omicron, no more worse, maybe not as bad. Not worse. Not worse, maybe not as bad. Now, let's talk about the Omicron. Omicron was nasty if you've never been vaccinated, particularly if you're over 65. So it's not that it's a nothing, it's a something, and it might start to cruise around again. But the bigger question is, let's see, BA2 is already 40% of the cases in the U.S. Numbers continue to fall. There's Andrew. So Andrew Ashkazvili is pointing out that U.S. is continuing to head towards very low numbers in spite of the fact that BA2 Omicron is 30 to 50% of the cases. So there you go. I do believe it could turn up, though. I mean, though we have so much natural immunity in this country, the question is, how long will the Omicron natural immunity last? And what I will tell you is I had mine measured, which was kind of interesting. I remember over the years, this last couple of years, I've been talking about the Additive score. Well, I had another Additive score done last week. So here I am, post-alpha 1 year, plus a couple months, post-J&J vaccine a year, post-Omicron 2 months, and my immunity looked very similar to immediately after alpha, which is interesting. That means that, and my Omicron case was very, very mild, which means that Omicron, in spite of being mild, still creates an exuberant, at least in me, and I think this has been observed in other cases as well, an exuberant immune response. So our collective immunity, given that there is so much natural immunity in this country, should be pretty good. Now, by summer or fall, could it wane? Yeah, it could. And the question then becomes, should you get a fourth vaccine? Yeah, how about Deltacron? Stephanie says, Deltacron, it's looming, it's looming. Yeah, Deltacron ended up being a nothing, essentially. But again, something like that could come around. And that's the bigger issue. What if something nasty suddenly emerged? Because it could, right? What are we going to do? I want to put that question aside. I'm going to write it down, make sure I get to it. What are we going to do if something nasty arises? That's one thing. The other question is what to do if we think our immunity is waning and we have BA2 running around summer or fall. So who should get the fourth? Really, it sort of begs the question of who should get the fourth vaccine, the fourth booster. I have begun, here's Andrew. Watch for the Northeast. They are next for the wave if we have one. The South is in the summer. Andrew, I agree with you, but I'm not sure that the seasonality is as predictable as we kind of thought it was at the beginning. But to your point, it certainly is a force at work. Northeast is cold right now. Summer still, the South is warm right now. So back to who should get the fourth booster. So I have been preparing my patients over the age of 75 for 6 weeks. That I believe there'd be a fourth booster coming. I believe it was even before Pfizer or whoever came out and started talking about it. I knew it would be necessary because if we're going to be boostering, the boostering immunity does not last very long. Okay, now the science around boostering is not super strong. However, the risk reward to me seems to be in favor of going ahead in spite of the science being that strong, right? As I said, 1,000 people over 80 are the ones that succumbed to the Omicron. Most of them not vaccinated at all, to be fair, but that's the group that gets hit, right? And so I have a group of patients over the age of 80, over the age of 75 really is who I was talking to, who had no response to the vaccine, no adverse effect to the vaccine or the booster, and are anxious that they would want the booster, right? They're motivated patients. They understand. They're smart. And I said, yeah, I think that for you, I think it's coming. For a 25-year-old, there is no science. There is no science. Now, you can do it. You can get boosted up. I will tell you that several members of my family got boosted, and the boosted group, amongst all of us who had Omicron, we all had Omicron save one, was much better if you'd been boosted. One of our sons had only had the original series, and he had a nasty go of the Omicron. It was nasty. And I have had a couple patients that had no vaccine, had Omicron. One nearly died because I couldn't get Paxlovid. So that's the other issue, is why are we talking anymore about ivermectin and hydroxychloroquine, the I word and the H word? It's time to stop talking about that. I don't mind people talking about the postmortem of why people behaved in such a weird way in response to other physicians talking about it. That's fine. We should talk about why there was so much consternation around a treatment that was not particularly effective, but certainly not harmful. Why did my peers go crazy about that? We should examine that. Not whether we should keep using these things. It's clear. There was a really good study just come out, I think in Lancet. Andrew Ashkashvili, again, I'd be interested in your position. There we are. Yeah, Andrew Ashkashvili. Your head goes right where mine does. He goes, by the way, where the hell is therapeutics? Biden said, if you test positive, you'll get therapeutics. Yeah, by the way, he's withdrawing funding from therapeutics. So if you don't have money, it's going to be an issue. There is I think 1 million doses out there or something. But once that runs out, this is not going to be cheap. That concerns me, number one. So the article I was referring to, Well, no, I don't have it. Let's see. Susan, did you send that article to me? Almost feel like Adam sent it to me. Well, anyway, there was an article. It was Adam, I'm pretty sure, that showed that, I think it was a Lancet article that showed that ivermectin doesn't work. It was a pretty good article. It was a meta-analysis. It was pretty good. I thought it was good. And Andrew Ashkasvili, I'm wondering what you thought about that. Yeah, Andrew, again, is right where my head is. He says, get widespread therapeutics out. We can stop talking about COVID. Yeah. Because then it will be no hospitalization increase, no deaths, because we have excellent therapeutics. Now, could there be some untoward side effect coming from some of these therapeutics? Yeah, always in medicine. Always something unpredictable can happen. And yeah, this could happen. But we have monoclonal antibodies, if you're nervous about that. We have good ones, diverse ones, all sorts of combinations now. And we will by the time BA2 comes around big, we'll know which ones are working with BA2. Monoclonal antibodies kept me out of the hospital, for sure. Okay, so I don't know what Susan's saying here. I'm on Clubhouse and ahead of the live stream. I'm not sure what that was. As I was saying, the therapeutics. So we should not any longer be saying, oh my God, early treatment. No, early treatment now should be molnupiravir, Paxlovid, monoclonal antibodies. That is early treatment. The reason we used to talk about the I word and the H word was because we had nothing else and they were harmless and there were some in vitro studies that maybe it might do something. So people were improvising and trying to do something to help people. Maybe it helped, maybe it didn't. I will tell you, nothing compared to the therapeutics we have right now. So now if you get sick, you should be taking what your doctor tells you. I mean, one of those three medicines. And if you're exposed, you can take molnupiravir and not even get it. So I don't know. I don't know why we're even talking about looming illnesses. We should be talking about, how do you get this medicine? How much does it cost? Who's going to get government funded Paxlovid? That is the story of the day if this thing starts to come up again. Then the next issue is, and this is part of sort of my topic of what to do if there's a nasty outbreak, if a nasty variant comes around, what do we do? Do we mask up again? Do we lock down? Now, everybody that is a fan of lockdown points at South Korea and China and the benefits they've had there. Nowhere did China ever complicate a national lockdown, ever. They did regional lockdowns. I would be in favor of regional lockdowns. Regions where there are outbreaks, you want to dampen it, fine. But shutting down a country is insane and did not work. Now, it gave us, to say it did not work is a little bit, again, hubristic again. I got to back off that. It gave us a little bit of time when we needed time, maybe did a little something, but ultimately the virus did what it did. So much like in Hong Kong, South Korea, I think New Zealand right now, you can just suppress it for a while, but eventually it comes back and does, and you end up with the same number of cases as if you had not done the lockdown. So the question then becomes, is the lockdown worth it? Regionally, fine. I have no problem with that. National lockdowns, to me, seem like a level of delusion that's hard to come to terms with, hard to understand. And that's me not being hubristic. Again, if my city had a big outbreak, you want to lock us down for a couple of weeks or a month? Okay, lock the city down. That's fine. That's all right. That's called quarantining. It's what we've always done in infectious disease. Shutting down a country has never been contemplated in the history of mankind. And it was, as I've discussed many times on these threads, built off a theory from a high school student in New Mexico who also never contemplated a national lockdown. Her thing was locking down schools locally to prevent influenza outbreaks. The Bush administration extrapolated that to sort of bigger lockdown sorts of ideas. Again, not do they work or not, and let's not talk about that. Let's look back and examine carefully whether they worked, and if they did not, which they did not. Same thing with school closures. Lots of countries did not do school closures, did better or the same as places that had massive school closures. I don't know if you noticed, but when the refugees were leaving Ukraine, this is one of the very sad chapter we're all bearing witness to here today and for the last, God knows how long it's been now, 2 weeks. And the one thing that jumped out for me was there was a lot of women and their children heading to Poland, right? We saw lots of that. Every mom that they interviewed said the same thing, and it just jumped out at me. They said, these kids have been out of school for 2 weeks. We got to get them back in school. They can't stay out of school for a month. They need school. We closed down for 2 years. And I tweeted some data a couple of days ago, I think it was yesterday, showing that particularly Black and brown kids did much worse in terms of impact on reading and education. We're okay with that kind of racism. We're cool with that. Our policies, you want to talk about systemic racism? School closures is a systemically racist policy. It just is. That's what people are talking about. When you do things that have a disproportionate effect, not on white people, you did it. Well done. Restaurant passports, same thing. And people then go, well, it's a personal choice to not get your vaccine. No, it's not. It wasn't a personal choice that my profession, I talked about this with the psychiatrist the other day, wasn't personal choice that my profession did such a shit job of developing rapport and trust and serving a community like the African-American community properly. We didn't do it. Okay, here's Andrew in here. Close the beaches and take the nets off the basketball hoops. Yeah, so, and Andrew, they didn't just close the beaches here. They actually soldered bars over the basketball hoops, and they took bulldozers and put sand into the skateboarding pools and whatnot, just precisely the place where they should be sending people, right? And not only that, when they opened the beaches, they said, okay, you can walk around on the beach, but don't stand there and don't lay a towel down. You can't lie down on the beach. I hope you will all remember, this was California. I don't know if you were subjected to the same kind of nonsense in your state, but that is the level of incompetence that we were subjected to here in California. Again, trying not to be hubristic, trying not to get angry. It's easy to say, oh, they didn't know, we didn't know. You didn't know. At that point, if we look back at what you and this group was talking about at that particular moment, I remember reporting on data. In fact, I was running in the Arroyo, a outdoor area here, and I looked it up because I saw people with masks on outdoors there, and it caught me as strange. And at that point in the pandemic, there had been documented 2 outdoor cases of transmission. So Alpha and Delta did not transmit outdoors, period. Nobody talks about the death rate increase with unemployment. Yeah, they do, Russ. They do. They're starting to now. The mental health consequences are profound. And God only knows what the long-term consequences are going to be on those kids that we have so systemically affected with our policies that ended up racist. They were racist. I'm Andrew. I'm the same with you, man. And that is something I learned. Andrew says, I can't believe Bar Ferrer still has a job. So that's something I learned as we look back on this thing. And again, I'm going to try to keep a reasonable attitude about it. And by the way, they still have school masking here in LA County because of a sociologist, not somebody who's ever made a clinical decision for a patient in her life and now making clinical decisions for large populations. That's not okay. I have noticed also that a lot of the public health people, because they were interested in vaccines and outbreaks, they're interested in little pandemics. They're pediatricians, because pediatrics is where you typically would see a lot of sort of outbreaks and where vaccines have particular relevance. They're pediatricians. And when I interviewed Dr. Hotez, if you remember, a month ago, I guess it was, good guy, enjoyed the conversation with him. But he said something that jumped out at me, and I unfortunately didn't raise it with him, and it bothered me afterwards. It's just sort of how my brain works. He started talking about how he would not want COVID because of the neurological effects. And don't you understand the brain shrinkage on MRI and blah, 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 blah. You get brain shrinkage on MRI in an old person if they get a urine infection. That is not necessarily permanent damage, nor is it necessarily related to the COVID. It may just be related to being very sick. So, yes, I do believe COVID is like a head injury. I've said it a million times, so I think it is a little more than that. But the pediatricians don't know how to interpret adult neurology. And I realized that. I thought, oh, you're scared of something you shouldn't be scared of. I had the hit in my head. I recovered. I'm learning languages now, and it's helping me even go well beyond where I was at my baseline as a 63-year-old when I got sick, or 62, whenever I got really sick. It is something that he has no judgment about as a pediatrician. So he's scared shitless of something that he should not be scared of. And that, to me, I thought, oh man, that is really interesting that we've had these pediatricians running public health policy, and that may be where some of these excesses are coming from. So there you go. Let me get back to you guys on Restream here, and I will go to a question in just a minute. Let me look at you guys on Restream. Let's see. How should civilians treat war injuries without proper equipment and no doctors around? Ooh, I'm not sure what that means. Russ, was he the one who responded to every question with, have you queried VAERS? No, I don't think that was him, because no. That was somebody who was, that was like Steve. That was Steve. Susan, help me with Steve's last name.
Steve
who was
Kirsch.
very concerned about the vaccine. Steve Kirsch, thank you. This was Peter Hotez, who's a brilliant virologist. He's really good. But I realized he was biased. You have to watch out for bias. I'm trying to watch out for my bias. I have a positive bias. I try to, encourage and look at things positively. And it leads to me missing looming threats. Let's put it that way. I'm not as excited about looming threats maybe as I should be. But it also makes me really upset when people use words like looming and grim and all that stuff. Grim milestone, that was it. Grim, another grim milestone, a grim milestone. Oh, will you shut the come on. Okay, so let me go back here and see if anybody commented anything. Why is there, I'm sorry. What is Lexington Green? I don't know what that is. Why is another hit piece coming out on you? George, I don't know if that hit piece ever came out because they were trying to do it. And I think probably somebody went in and watched one of these streams and realized they were doing what goes typically viral is, it's never what I said. It's what somebody said I said, or interpretation of what I said that then becomes factual. And thankfully, I think maybe they did their job as a journalist and looked at what I have been actually saying. Yeah, they were saying I'm a conspiracy theorist and I was adhering to weird, strange ideas. Really? Please name one. Name one. The only thing where I think I could be sort of could be reasonably addressed is on masking. I have a optimistic masking, and there are studies on masking that people throw around as showing that they work, and those are not great studies. But I am willing to concede that if you are somebody who wants to protect yourself from the virus, you wearing a carefully fit, consistently worn N95 or that class mask, that will help you. That will help you for a period of time. But when you take your mask off, it's like, or you lower it to eat on wherever you are. I mean, that's my concern, is that it has to be worn perfectly, much like you would wear it in a patient room to prevent an infection from getting in. You wear it perfectly with all kinds of gear. Out in the world, people don't do these things perfectly. And so it tends just to be a kind of a temporal issue that might help you a little bit, but doesn't help the population at large. So again, if you have a grandparent with aplastic anemia or something and you want to protect them, please do. Please do that. So don't confuse my recommendations for a given individual, wear a mask, or a given situation medically, where masks, why not wear them? Be extra careful. Don't confuse those two conditions with population-wide recommendations, which have been studied in Denmark and Bangladesh. And by the way, the Bangladesh data was re-examined, open to everybody, and it looked even less effective when they opened it up than the original publication. So there you go. Andrew, or you reuse the same mask for a week. That is another issue that people have been raising recently, which is that pathogens can get in there, caught in there, and become an issue as well. So,
speaking of the hit piece, Drew, I don't know if you've noticed it quite yet, or if anybody's noticed this little trick that I do is that anytime you or a guest says something that I feel like they might cut out of context at some point, I always make sure to drop in this live marker that's over here with the date on it, so that they can't pull it out and say, good. Drew said this yesterday when it was something you said 2 years ago. I try and get ahead of it a little bit by hard coding it in.
Yeah, and be sure to, if you hear me getting a little bit, sort of overly hubristic, which I'm really trying not to do, please jump in. I'm happy to take direction. I'm also happy to change my position. I'm happy to. I am somebody that craves input to expand my point of view. I want to be challenged on these things. So I'm happy to have discourse on this stuff.
I think people don't, especially reporters, don't understand how many hours of content you create almost every single day of the week. So you're saying stuff that's current news. It's not like nobody had time to research all of these points at the beginning. You were saying it as your experience and what you found.
Well, you've been sitting in the driver's seat listening to me say these things. Have I changed my point of view dramatically? I'm sure I've changed it because I
not
try
dramatically. But you've been happy to go back and correct yourself, and you haven't been embarrassed about it. Like that I feel like is way more important than the people that they say I'm right and then they deny things later on. It's so much better, and I respect it so much more.
Well, let me be clear. I will get some things wrong. There's no doubt in my mind. It's just the way it is. I will get some stuff wrong. And but I do, when I look back at the arc of this thing, my instincts generally have been quite accurate. I may have gotten some of the details wrong, and I may have missed some glaring things at the beginning, but my instincts have been pretty spot on for this. And so, and
Susan makes a good point in the chat that we don't edit any of this. This is all you're saying live, straight to the camera, live, nothing cut. So
right. All right, let's go to the clubhouse and get some calls in here. Thank you guys for raising your hand. Tom, what do you got?
What's up, buddy?
What's happening?
Hey, I'm just doing backflips right now. This fact that you just said that you would be okay with local lockdowns. Oh my Lord, I can only imagine what your buddy Corolla would be saying right now.
Yeah, he would be against it. He would be against it. My thing is, I wouldn't welcome it, but I would. But I'm interested in people doing what's consistent with currently available knowledge, and people that if people want to look at China and go, oh, look what they did. Okay, they had some success. I get it with local lockdowns that were draconian, by the way, but local. Yes. And if you want to follow that, I can't argue it on veracity. I can argue it on philosophy. Like I don't want to do it. Like it sounds awful, but I can't argue it on consistency. At least that's consistent.
Here's my question for you.
Yeah.
Over 2 years into it, why do you think, with everything that everyone knows about the severity of COVID, why do you think China continues to probably have the most, as you might say, tyrannical approach to locking down, in this case, 37 million people? What do they know about COVID maybe that the rest of the world doesn't?
Well, pull back the curtain on your question. Are you saying that they invented it or developed it or maybe know something?
I mean, who knows?
Yeah. But what I would say, and I've said this all along, here's my take on it, is that at the moment there was an outbreak, they immediately kicked into gear with this sort of lockdown and strange interventions, like I've said before, like chlorine trucks rolling down the street and stuff. Things that you can't just get together in a day. You have to have previously planned on this. Now, if they planned on it, they could have planned on it because they were worried about biological warfare. They could have planned on it just because they have a virology lab nearby. Or they could have planned on it because they were aware that there was some pretty serious shit going on in that lab. And by the same token, think about how that government is organized. It's organized like a narcissistic structure, which is you got to impress the boss. And so nothing can get through to the boss. So the boss doesn't want to have a problem. He wants you to handle the problem. And so it might have been the local communist leaders going over the top with their interventions. The strange thing is that we then and Italy and us fashioned everything after that. Yeah. That was very strange to me. Nowhere was that contemplated in medicine. I remember I've said before, I was doing a nightly television broadcast right in the middle of this, and I was sitting there and somebody from the school board came in and announced that he was going to close the schools out. I said, who told you to do that? Where did that come from? Why is that even an idea? No, we just think it's the right thing. Okay. And that was it. That was the end of it.
One last one. Do you follow Caitlin Jetelina? I believe is how you pronounce her name.
Is that on Twitter?
She has the headline or the header, and I've been subscribed to her throughout the pandemic as your local epidemiologist.
On Twitter?
She might, it's a great question, Drew. I just know that I subscribe to her email and I receive her reports weekly. I'm just curious if you follow her. But
well, I'm looking up right now. You're local. I remember seeing somebody that had a name like that or something. So I've come across her stuff.
As a dummy, that's who I've been following for a lot of my data. And by the way, for schools, one of the things that she released about a year and a half ago, she said masking in conjunction with proper ventilation is extremely effective. And they had a full they had a full breakdown of everything, the mitigation and how much it did and all of that. I just wonder, so we've talked a lot over the last couple of weeks, but I wonder why. I don't hear anything about proper ventilation in schools ever. I only hear about masking.
Right.
And
so because and not only that, think about what they've done to proper ventilation. They've put plexiglass shields up which prevent ventilation. So I think that's why you don't hear about it, because they've done this here in Los Angeles. That was required by the school board. Again, not the public health department, the school union rather. As I recall, and I could be wrong on this, but my recollection is that they demanded that. Because I remember one day I was interviewing someone at the school board, and she was saying, "We need this, we need that," and one of the things was these shields. And I said, "Well, let's do it then. We got to get the kids back to school." And she looked at me and she goes, "You're sexist." I was like, I want to get to what you want. It's what you want. Let's do it. What's the delay? Don't talk to me like that. It was the most shocking experience. Anyway, she is on Twitter, and she is on Twitter as Dr_KK Jetelina, Jetelina. So Dr_KK Jetelina. So I'm
maybe next time we talk, you can tell me what you think about her.
I'm following her now, so we'll see what that is. Awesome. She looks good. But I'm going to just say one thing about that particular observation. I'm going to bet you it was more the ventilation than the masks.
I agree.
Just betting. I agree.
Only because think about, I told you kind of our story a couple of weeks ago. Yeah. I've never contracted COVID. I've not been vaccinated. I wear an N95 when I go into public indoor places, but we've enjoyed ourselves, and we've always, for the most part, we stuck to just visiting outdoors with our elderly family, and it seems to be good.
Of course. Well, it's a little empiric study, but it fits currently available wisdom, right? It fits what we think is the fact. So thanks, Tom. I appreciate those comments always. Let me see if I think it's Amy up here. She has a comment about it. What we've been talking about here. Amy, I'm asking you up. You'll be streaming on YouTube, Twitter, Twitch, Facebook, and multiple, and I think Rumble also. If you want to come on up, you've been asked. Let me get, in the meantime, I'll ask Diane up here. Diane Insera, if that's you. Again, you guys are in the room with your hands up, and then I click on you, and that's when you come up to the room, come up to the front, and you can ask your question. So Diane, I've clicked on you. Amy, I've clicked on you. And there we are. Diane, what's going on?
Hi, Dr. Drew.
Hey there.
I've got a question about post-exposure prophylaxis treatment.
Mm-hmm.
I'm vaccinated and boosted, Moderna, but my niece tested positive on Wednesday.
Right.
And, I was around her a lot for a good probably 18 hours, no mask. And I'm just having a hell of a time getting my doctors to prescribe any.
Okay, so let's talk about the risk reward of all this. How old are you now?
54.
Do you have any underlying medical problems?
Yes.
What do you got? If you don't mind. You don't have, if you don't want to tell me.
No. Yeah. It's totally fine.
Yeah.
I actually appreciate you going over it. I've got sinus node dysfunction with underlying dysautonomia, fibromyalgia, and major depressive disorder.
Did the dysautonomia get caused by the vaccine?
No, but
okay, good.
Thank goodness is right. I have had chronic hives though since the vaccine.
Interesting. Weird, huh? That's crazy. Okay, so you've got some issues of concern, though not classic risk factors, and your age is getting near problems. And she, is your niece, right? Your niece?
Yes.
Niece, is she sick?
She is. She has a fever and just mild back pain and some fatigue.
That back pain is so characteristic of COVID.
I know.
It's crazy.
That's what
It's weird. So it's weird. For me, it was like crushing back pain. First time. Second time, none.
Wow, that was my first symptom, Drew. I didn't even know that was part of COVID.
Yeah, I remember.
At all.
Yeah.
Wow.
Oh yeah. Back pain, headache. Yeah, back pain. But the back pain is weird and crushing. In fact, my son, when he got Omicron, he called me. He's like, "Oh my God, my chest! Something's wrong. Something's terribly wrong." Yeah. I went, "You're getting COVID, dude." So you were around her when?
Wednesday evening, and we were together. And
Friday.
I knew that, and I know she wasn't feeling well. I took her temperature. She had a fever.
Okay.
And we tested her the next day, and she was positive with a home test.
So you are 2 days out, right? Not a week and 2 days, but 2 days. All right.
Well, yeah, about 2 days.
2 days out.
As of 6:30 tonight.
Yeah. And when was your booster?
The booster was in November of 2021.
So it's a little bit longer than because I'm not really clear. You hit towards 6 months, I get kind of, I worry about that booster. So there is some reason for you to me, that's the compelling reason to think about your age and the fact that the booster was long enough ago. Now, if you get it, it's almost undoubtedly Omicron. It's 50-50 BA2 versus the other. And it is unlikely to be significant. It's very unlikely to be a hospitalization or a. However, it's going to be a pain in the ass, and I understand that.
Sure.
Trust me, I understand it. So the drug that is most associated with, there's two ways really to approach it. Either monoclonal antibodies, which they give by various routes, and that's not particularly great these days against Omicron, and we don't have a lot of information with BA2 yet. But molnupiravir is always talked about as a good prophylactic agent.
What about, have you heard of Xeudy? And I'm probably saying it wrong. Xeudy. Xeudy. It's sotrovimab, I think. Omicron is the one that's really circulating where I live, and they said that the recon something, that other one that's out.
Okay, hold on. Sotrovimab.
Yeah.
This is the one. It's the one that's working, right?
Yeah, that's what I read.
Yeah, and sotrovimab. Yeah, that's the one that's working, and you can get that as a prophylactic agent, I believe. It's Xevudy. Zevudy.
Yes, that's right. What if I can't get my doctor to do it? I mean, it's just so frustrating when I know it's available.
I know. I am so upset. This is the stuff that makes me upset. This is the same thing that's been happening since the beginning. Physicians that aren't really familiar with these treatments are afraid of being judged, or there's no clinical pathway in their particular program that allows them to follow the algorithms they have.
Yeah.
I would start looking. I'm going to bet there are urgent cares in. Where do you live?
Omaha, Nebraska right now.
I'm going to bet there's an urgent care near there that does it. You can go on the CDC has a site for finding molnupiravir and Paxlovid. I'm going to get the name of that for you in a second.
Okay. I did find a pharmacy that had this sotrovimab, but I can't get it without a RX. But like you said, I might have to try an urgent.
You have. That's what I've been having patients do. If there's any, if they're not under my care, and I've been sending them around, I'm not aware. Okay. I mean, you can try, telemedicine with somebody. I know that there are aggressive telemedicine groups out there that want to try to help. And,
that's a good idea.
And you can, a lot of those, I hope they're up on all this stuff, but yeah, I would fight for it. I would fight for something. Either there's enough in your thing. And if your booster had been 3 months ago or 2 months ago, I'd be like, you're 55, you're not 65, but sotrovimab and the, it's kind of interesting. Well, no, the molnupiravir. The molnupiravir is the one that's talked about in this setting. It's just interesting because it's interesting to be boosting spike protein antibodies in somebody that has a lot of it already. It's just sort of an interesting clinical situation. But the question is how much, and will it be effective to ward it off? And you have some good data now on prophylactic use of monoclonal antibodies. So tough question, but something, it seems like you're super motivated to get it. So, I mean, you should be able to do so. Thank you for that call. I really appreciate it. Very interesting, challenging set of problems. Amy, I had clicked on you as well. I will click on Dave to see if he wants to come up also. I'm wondering, Caleb, do we need to take a break today too? Is today a day we need to
yes. Let's see, where's
what? Oh, here's Amy.
Yeah,
Amy made it in. So we'll take her call and then we'll take a break. Go ahead, Amy. Oh, Amy, you got to turn your mic on. You've got your mic on mute. Did you guys like the general yesterday? I thought he was very interesting. Amy, you're still on mute. The little microphone in the lower right-hand corner, you have a little line through it, and you got to click on it so that line goes away. I'll tell you what, Caleb, let's go ahead and take our break now while Amy struggles with the technology a little bit. And we'll be right back with more questions, and I will review some of the stuff on Restream. I had my eye off of that. Oh, Amy still got the mic muted. Be right back. Since the beginning of the pandemic, nearly 1 in 5 Americans has reported consuming an unhealthy amount of alcohol. Could be you, but only 10% of them are actually getting the help they need. Reframe is a neuroscience-based smartphone app that helps users cut back or quit drinking alcohol altogether. Using evidence-based tools, techniques, and content, Reframe guides users through a personalized program to help them reach their goals. Comprised of daily tasks, a comprehensive toolkit, a community forum, and accountability guides, Reframe is a modern, accessible, and affordable resource that can help anyone looking to reevaluate their relationship with alcohol. Reframe is backed by Harvard University and Emory University Schools of Medicine, and it is ranked the #1 alcohol reduction smartphone app worldwide with over 350,000 downloads. With Reframe, there's no stigma, just science, no labels, just support. To learn more, go to joinreframeapp.com/Dr. Drew. Use the code Dr. Drew for 25% off your first month or your annual subscription. That's at joinreframeapp.com/Dr. Drew. Let's talk about our friends at Hydralyte. I can't say enough about Hydralyte. You hear me talk about them all the time. It gets me through workouts and medical procedures and colonoscopies and COVID. It absolutely contributed to my recovery from COVID. Hydration is key to feeling healthy, and there's never been a time when that could be more important. We're in the height of cold flu season. Every headache has got you testing for COVID. Staying hydrated can keep the questionable symptoms at bay, and there's nothing better than Hydralyte to get it done. Taking their hydration formula one step further, now there is Hydralyte Plus Immunity. It starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single-serve, easy-pour drink mix contains 1,000 milligrams of vitamin C and 300 milligrams of elderberry extract. Hydralyte Plus Immunity comes in convenient, easy-pour powder sticks that rapidly dissolve in water to make a great-tasting drink that has a 75% less sugar than your typical sports drink. It uses all-natural flavors. It's gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydralyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy, or as always, you can find it by visiting hydralyte.com/Dr. Drew. That is HYDRALYTE.com/Dr. Drew. And be sure to use that code Dr. Drew 25 at checkout for a special discount. And we are back. Amy's ready to go in just a second. But before we go to her, Susan Pinsky picked out a question on Restream from Lou Hoffma, who said, Drew, do people with Alzheimer's know they have it? And I suspect you mean, do they know they have dementia? I don't know if you mean, do they know they have dementia or do they know they have COVID? But I think the same answer applies to both, which is it depends how severe the dementia is, right? There it is, Lou Hoffma. Which is that early on, people do know they have dementia. They are aware that they're having to write things down. They're aware they can't remember things. Their new learning is off. They have all kinds of interesting complaints. Oftentimes people cover for it. They sort of pretend it's not happening, and who wants to really acknowledge that. As it gets on, it's hard to deny it. But if it's a rapidly progressive dementia of some type, they quickly lose the capacity for insight. Alzheimer's particularly, there's several different kinds of common dementias. There's vascular dementia, there's Lewy body dementia, there's frontotemporal dementia, and there's Alzheimer's type dementia. These are the common ones. And a lot of dementias are vascular, to be fair, but be that as it may, and think about it, post-traumatic, head injury, CTE is a kind of dementia. And I feel like if there's any dementias following it through COVID, it's going to be kind of like that. But with Alzheimer's in particular, the self dissolves. The parietal region of the brain where sort of self functions reside really is the primary region of dissolution of the brain. And so nobody's having the experience anymore. You cease to be sort of aware of your awareness. By the same token, if you have one of the other dementias, the frontotemporal dementias, they tend sort of not to care so much. The Lewy body dementias have so many other unpleasant symptoms. Those are the things that bother them, hallucinations and things like that. And when you can't remember minute to minute what was bothering you, that is a blessing. That is a blessing. So there's that. And again, this important question as it pertains to COVID, with people that advanced dementia in nursing homes get COVID. I mean, how aggressive do you want to be? Family, patients need to talk about that very, very soon if somebody in your family has dementias. Amy, go ahead.
Oh, that was just really interesting. The dissolving of the sense of self. Do you think that when you were just talking about dementia, the one where the sense of self dissolves, it just made me pause on whether the spirit is still there, but unable to communicate.
Well, these are the tougher questions about consciousness, right? Whether or not you can have some lower level brainstem thalamic function that is a proxy for consciousness. And then that's different than the soul question. And I would say the soul thing becomes sort of a question of temporality as well as anything else. Is something like the soul something that exists always, even when it's not existing in the present moment? Bigger questions than I can answer, I'm afraid. I will tell you that a lot of people do get very heated about the idea that lower brain function has some meaning. For myself, no thank you. No thank you. I don't want to be sustained with just that function, if that's what we're talking about. I've seen people with that kind of lower level functioning, and is not something I want to have anything to do with. So again, something important to talk about.
Yeah, I would agree. I wouldn't want to exist in that, but it seems like a good opportunity to maybe communicate with spirit or soul, for lack of a better word.
Tougher questions.
Yeah.
Right? I see people keep people alive as completely brain dead, but with a beating heart in incredibly long periods of time, with that notion in mind. And to me, that's torturing the actual individual. Okay, that's my opinion. Plenty of other opinions out there.
Yeah, it's a case-by-case thing for sure.
So
has to be.
What's on your mind?
It's a little bit of a different subject, but it had to do with the swim meet where the trans athlete won. I'm sure everybody's seen this, but I was wondering, I wanted to ask you this because you were around in the 70s with the Boston Marathon and the woman running it and Billie Jean King. And we saw the, equal rights for women, that whole movement. But what it seems to have done, in my observation, is created a separate but equal situation where women aren't viewed or paid as much. And it's almost like they're fighting for second place. And the other factor that I was thinking about was DNA. This discovery of DNA should have called into question all pattern fields. And now we know that there are more than two genders, XXXY, all these different things.
We've known that forever. That's actually different biological sex. That's not even different gender. Those are different sort of expressions of sexuality, of biological sex.
Oh, right.
Yeah.
Sorry. Sex
all right.
well,
Let's give us both a certain amount of grace here and say We are trying to get this right. We're trying to use the proper language. We mean no harm to anybody. We're just having a conversation. And please,
yeah, I'm just trying
we
to.
both want to get it right. So please straighten us out if we get it wrong. You go on Restream and straighten me right out there. But go ahead. I'm sorry.
Oh no, I appreciate what you said earlier, which is when you acquire new information, you try to integrate it, and so what I was thinking today was, if we begin, women, well, AFAB, I think is what it's called, and I like that part, fabulous, but AFABs tend to be more bendy, and the big argument, it just seems like women, AFABs have been put into I'm just going to call it male-dominated sports. Who's stronger, who's faster, who's better. And maybe I'm just wondering if we should start seeing human beings as individuals, where AFAB humans are, or I'm not sure how to even say it. It is.
I know it is hard to say. It's hard to talk about, and it's very complicated landscape. In other words, I think you're sort of talking about empowering AFABs, which is a designated female at birth. And I don't know what to make of AFAB anymore, because, listen, I have to take care of an XX differently than an XY biologically. And an XX that has a gender, is taking gender assignment medication or something, that's a very specific biological process that I have to understand thoroughly, but it's based on the underlying biology of the XS. And the same thing, the XY is going the other direction. I have to understand that biology. It's not somebody XY becoming XX. That is not what happens at all. It's somebody XY, the basic sex biology, being overridden or altered by various manipulations that we do because of gender. Gender is not sexual orientation. It gets hard right away. Gender is not sexual orientation, and it's not sexual biology. It is a separate phenomenon. It's much more complicated. I certainly agree with that. But you're wanting to get into the issue of what to do with empowering women, I think, right?
Yeah, it's just distressing to see what's going on in the news today.
Yeah.
And I've worked on, as a massage therapist, I've worked on over 8,000 bodies. And no two humans are alike, not even close. And because of this experience and with the idea of DNA, we really are unique individuals. And we continue to try to segregate each other into groups, oftentimes who's the most victim group.
Yeah, well, that lately.
And it just seems to be dragging humanity down, where if we can respect.
Certainly it's more this country. So what I'm thinking, more this country doing it.
For sports. Oh yeah,
but when you start going down the road, it gets very weird very fast. Like, for instance, why can't I play in the NBA? It's not fair. So why don't we have a division of the NBA where guys that are only 6 feet tall get to play? Why not? And oh, by the way, why don't we just forget it? Don't even limit it to men and women 6 feet tall in the same league. We're all 6 feet tall. You know what I mean? It's very weird in sports. And
for team sports, you can qualify it. I don't think it matters height, size, all that stuff. But the individual sports, like the running and the swimming, that might be better served like the way they do with fighting, where you
weight
do
classes,
the height.
Weight classes. Yeah.
Weight class, and then, but beyond weight even, like with the XX and then the hormone levels, like, why not? We have the computer technology now. Why not?
I think your point. I think your point is well taken, and it's one way to sort this out, is to really dig into the weeds on it and start to have criteria that are not based on gender or biological sex. But
we're not based on groupthink, where you have to be like, what is a woman? I mean, we're not in Eden anymore. Sure, God created man and woman, okay, but we're not in Eden anymore. And so what are we dealing with, and what do we want competition to look like? Because it's sad. Women's women are being placated in men's, in I'm not going to call it men's sports, archaic sports, in traditional sports.
I think it's way out of my league to have this conversation, but I appreciate you bringing it up, Amy. I don't have a strong opinion. Again, this is one of those areas where I just sit and listen and just try to get it right. It's not an easy thing to get right. I got a few more questions I got to get to. So Dave, you've been clicked upon. Let's bring Chris in the meantime. Was Chris, you're up. What's going on? Was Chris, you there?
You have two people.
Yeah,
up.
I'm here.
What's
I'm
up?
here. Sorry.
What's going on?
I pressed the wrong button.
Okay, let's do it.
All right. So I just kind of wanted to report in on kids in schools. We had our mask mandates lifted here.
Hey.
And which is fantastic. We get to see how much these kids have grown and changed.
How crazy. You haven't known that. Didn't even think about that piece. Right? Oh my gosh.
But here's the crazy part. So, with kids wearing masks, I have 3, and I know a lot of kids. I've always been around kids. They're disgusting human beings, but thank God they're cute. So they were still reaching up under their masks and picking their nose and wiping stuff on their sleeves the whole time.
Of course.
But ever since the mask mandate got lifted, one thing that's really been hitting the schools hard is so bizarre. Kids having a ton of cold sores, a ton of kids getting strep, a ton of kids coming down with just stomach bugs.
Yeah. But
the craziest part after quarantine and virtual learning is how many kids are wearing glasses now.
Huh. I
would say 1 out of 3 are all wearing glasses.
What age group?
Well, the school that my children attend only goes up until 6th grade. So I would say from the kids I'm observing,
so 5th grade is
to 12, 13.
5th grade is sort of where that comes on, right? So like 9 to 12 is where you start to see a lot of glasses for distance, for myopia. But are they doing it for distance or reading?
I think most of it's for distance.
Yeah. I didn't know what to make of that. That's interesting.
It's just weird. And the other thing is just, seeing the kids without masks. Now, I put my kids in masks. The school wanted them to. I didn't care. It was akin to just asking my kids to put socks on in the morning, which is a grace in itself. But all of a sudden, seeing all these faces again and seeing the kids playing together, even if they're disgusting and covered with cold sores, it's really, really wonderful.
I wonder if the cold sores were there under the mask. You just didn't know it.
You got a point.
Yeah. Hey, did you understand what I was telling you today about your calcified
with my torticollis?
Your calcified sternocleidomastoid muscle. That's a weird finding. That's not. I don't know. That needs an explanation.
It's bizarre. It runs in my family.
Calcification of neck muscles?
Yes. Every first female born throughout the past 4 generations have all had torticollis on the right side.
Yeah, but torticollis is one thing. Calcification of a muscle is what you said. And that is
well, that's what somebody told me. They could have been wrong.
All right. Well, that needs an explanation if that's in fact what was, because that's not torticollis. That's something else. Torticollis,
basically,
for those of you who don't know, it just means the neck is sort of pulled to one side.
The sternocleidomastoid muscle on my right-hand side has been tense since I was born. My head was stuck to this side. And as I got older, it got progressively worse. So everything on my face.
There's obviously a genetic piece here, and it should be sort of figured out.
Yeah.
All right. I got to keep going through some more calls.
Thank you so much. God bless.
All right. See you.
Peace in Ukraine.
Bye. Yes, indeed. Dave, I'm bringing you back up. Sorry, you got to turn your mic on. And there you are. Mic. Turn the mic on. The little mic with the line through it in the lower right-hand corner. You need to click on that. There you go. Oh, now you went away. I'm not sure you clicked on the right thing there. Okay. Let's get Bass 53. There you are. Sam?
Hi, Hitler.
Hi, Hitler. Hey, Hitler. What's up? And for those of you who don't know, that's a greeting at your mom's house. That means nothing more than that. But go ahead. People get very weird about that.
So this is less of a question and more of a story that would make any dissociate.
Okay.
So I was talking about it with my friend. I just remembered it. What we used to do was this thing called sky shits. And what we'd do is we would go into the bathroom at high school, put our feet on each side of the stall, and then shit.
Good time. Well done. It sounds more like a Corolla type thing. But thank you, Sam, for the colorful commentary. I appreciate that. I'm bringing Dave back again. See if we can get Dave up there one more time. Dave, you got to, and then we're going to kind of wrap this all up. Dave, oh well. All right, let's kind of wrap things up here. We appreciate you guys coming by to listen to my diatribe here. I want to finish a thought that I forget her name now, the last female caller who was talking about gender issues. She was referring to some of the gender stuff that was going on in the 70s, which was Billie Jean King, this whole, who's the greater athlete, the man or the woman. And Billie Jean King did an amazing sort of job sort of asserting that women could compete with men. At the time, there's Dave, there was Renee Richards, who was a psychiatrist who was a transgender individual. And she was a tennis player also and had a really interesting impact on people's thinking. Dave, what's going on?
For that, anyway, my daughter has diabetes, and she's not this, and she's seriously considering it. To gastric acid for 9% cure rate type. Do you know about that?
You're talking about do you say gastric bypass?
Gastric bypass. Correct.
Okay, your computer or something is way off. I'll just try to answer it. Look, gastric bypass is obviously if she has type 2 diabetes, which means that she has adult onset diabetes. A 1 type is the more common type, is where your body develops so much adipose tissue that it outstrips its ability to meet its insulin demands. So losing that fat and getting on a much more tightly controlled diet is obviously a very significant benefit in terms of reducing the impact of the diabetes and sometimes reversing the diabetes. I don't know the data off the top of my head, but if this is someone who is getting sufficient health consequences from the weight that they want to try some form of gastric bypass, just be very careful. Gastric bypasses are not panaceas. People find their ways to eat through it. I've seen lots of problems with them, including chronic dumping syndromes, chronic malnutrition of various nutritional issues of various type, and even more commonly, reflux that results in aspiration pneumonias. And this can be quite troubling. And alcoholism. That's the other thing. Because of the way the stomach dumps alcohol into the small bowel, somebody can have a mild genetic risk for alcoholism. It can suddenly turn on after the gastric bypass. So I'm not against gastric bypass. I just think that you have to really be very cautious with which procedure you get and what your expectations and what your intentions are in terms of having a clinical effect. All right, let's wrap this thing up. Thank you all for being on the Restream. Let's look at your guys' comments real quick before I go. Thank you for the questions at Clubhouse. I hope my little half-hour monologue made sense to you all, and I appreciate some of your comment as I was going along there. Most people are magnesium deficient these days. That is true, Stephanie. I always tell people I had a fellow in endocrinology used to always pound on me about the importance of magnesium. So I think magnesium supplementation is not a bad idea. Let's see. Any more of your questions on the Restream? All right. Excellent. Well, thank you all for being here. We'll be back on, let's see, is it Tuesday? Is that right, Caleb?
I'm not actually sure what the schedule is next week. It could be Monday.
We have it could be, because we have a very special guest that Michelle is working on that we have given sort of complete latitude to. If there's any time he can come in here, we will make it work. That included Monday. So we'll see about that. I've been working with Michelle on a few interesting guests, and people like Matt Ridley, things like that are hopefully coming up next week. But in the meantime, have a good weekend, everybody. Thank you for being here. Ask your questions. Hopefully made you all think, and you made me think too at some of your questions. I appreciate that. And we will see you on, as far as I know at this point, Tuesday at, let me double check the time. I think it's 3 o'clock. Tuesday at 3 o'clock. We will see you there. We were watching this, the Ricardos thing on, and we watched a documentary on them and stuff. And when they were happiest, I noticed they were teasing each other and kind of goofing around in the way that we always do.
Yeah, yeah.
And I thought, we've done that for 40 years.
And nobody knows
Hang
that
on.
Drew's funny.
Listen to me. Thank you for that. This is we Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/